Okay. We are going to start talking about phlebotomist. Is anyone interested in this avenue?
No.
Alright, well, we're still going to talk about it. In this lesson, you will discover what a phlebotomist does, where they do their work, identify physical requirements of the job, and determine specific education requirements for the role. Riley is the phlebotomist, and we'll be learning from in this lesson. Riley has been a phlebotomist for 5 years, and she's going to tell you a little bit about the job. First, a phlebotomist anatomy. Can you all see that?
Kind of. Not so long, probably.
Calm tone of voice to calm anxious patients. They should be compassionate and kind, have a big heart, steady hands, that's pretty obvious, a sharp mind to deal with challenges at work. They should be cheerful and smile to patients, have good communication skills, and a high level of patience. And strong feet, there's a lot of steam. It's kind of a cute little picture. Hi guys, I'm Riley, and I really enjoy being a phlebotomist, so I'm going to share some information about the job with you in case you're interested in the field as well. If you've ever had blood drawn, who's had blood drawn? Some of you haven't ever been stuck with a needle?
I have.
Oh,
Well, what? You haven't had blood drawn? So you've all had blood drawn?
Yeah.
Has anyone not? Really?
well, like, what does that mean? Like, you know when they prick your finger and they like
No,
squeeze
so
it
they
No.
would have gone like here or probably here.
Okay, yeah, no, I've never done that.
Oh, okay.
Yes.
I wonder if we could do that today.
Maybe
No,
not.
it's not fun.
I can practice on you.
Wait, I will totally let you practice on me.
Okay.
I
You have to sign a
totally
waiver.
Me too.
But
Get away,
blood
bro. I'll sign
donation
right now.
Yeah,
and,
should we do it?
Yes,
blood-
I'll sign the waiver. 100%.
I will watch
I
you
was already
practice
blood
on
drive.
X, but I
Oh
will
wait,
not.
What?
I was already planning on doing like this big thing, like getting a big red bus for my 16th birthday.
Oh yeah, I can donate blood now. I'm 16.
Yeah.
We should do that.
I was thinking of doing that.
That's awesome.
Like having a fundraiser and like a bake sale with it as well.
That would be
You
awesome.
should definitely get a waiver though to practice. I'll sign it.
That's
Maybe
not
that
how I
would be,
wanted
that
it.
would
As
go
a
on a class
birthday.
field trip to the.
Yes, to the big red bus.
Come on now. You
Yeah,
gotta, you
that
gotta
would
get
have to
on
Alright,
that.
I'll put it in the books, okay. Ooh,
You
good
should-
idea.
How long would it take though to get approved?
Alright, if you've ever had blood drawn, then you've been helped by a phlebotomist. Our primary responsibility is collecting blood from patients for research, testing, transfusions, or donation, while causing as little pain as possible. Unless you're rude, and then I may get hurt. So be nice to people with needles, right? That's a given. Many patients are afraid of needles, or sometimes you may need to draw blood from an infant or young child, which can be difficult. Frightened people can be unpredictable. Phlebotomists must be able to handle a patient's fear and behavior when preparing to draw blood. We must also explain the procedure to the patient in terms they can understand, which can help them to be more relaxed and less nervous. Precision and accuracy are very important parts of our job because the results are relied upon by doctors to diagnose, treat, and monitor patients. We don't only need to know how to find a vein, but we need to make sure we are verifying identities, knowing what vials we need to draw for each test that is ordered, and labeling vials carefully. Safety is also extremely important to prevent the spreading of diseases. Using proper safety measures to prep and clean equipment and work areas, and wearing the proper PPE. What's PPE?
Personal protective equipment.
Do y'all think you knew that before this year?
No.
Wearing proper PPE gear helps keep both employees and patients safe. Duties of a phlebotomist: correct ID of the client prior to collection, collection of the appropriate amount of blood for the specified tests, selection of the appropriate specimen container. Why do you think there are different specimen containers for different tests?
Because there's different blood type. Wait.
So, do you think when tests are ordered, is there just like one tube and they put it into the
No,
collection
there's
device?
No.
There's certain tests where like you have to get for allergies or an amount that you want to donate.
So what do you think is the difference between one tube and another? One collection
How
device?
strong? Like, cause when I got my allergy shots, it was 4 tubes.
Okay. What
So,
color was it?
What? The
Do
blood?
you remember what color the top was?
The top, I think it was.
So blood container, like when they're drawing their specimens, they all have different lids, and that's how you know which one you're doing. Each test has a specified lid because some tests, they can't have the blood clot. So there's anti-clotting factor inside the tube, so when the blood goes in, it keeps it from clotting. Other ones, they want it to clot, so it doesn't have any of that anticoagulant. And other ones have different chemicals or things to react with it to water it down or keep it, whatever they're gonna do with it, depends on the test. So it's really important that they know what tube to use for the proper test. Let's see, correctly labeling all specimens with the required information, appropriate transportation back to the lab in a timely manner. Some tests have to be on ice, some tests don't, some have to be spun down within 30 minutes of being drawn, so there's all different things that we need to know for that. They need to have effective interaction with clients and hospital personnel, performance of related computer operations and record keeping, observation of all safety rules, and attendance at continuing education. Work environment, as a phlebotomist, provides a lot of flexibility. You can work at different kinds of healthcare facilities such as hospitals, blood donation centers, doctor's offices, nursing homes, and community health centers, to name a few. Besides the hospital, most of these locations operate during normal business hours. As a result, phlebotomist usually works at schedules like Monday through Friday. In a hospital or urgent care facility, a phlebotomist may have night, holiday, or weekend shifts. Physical requirements. As with a lot of medical fields, doing this work requires a lot of movement and standing. So taking care of your health and your feet by staying fit and wearing proper shoes will help you feel your best while working. It's also necessary for a phlebotomist to be good with their hands and have excellent hand-eye coordination. Accuracy is key in this job. Errors could harm patients and impact test results. Educational requirements. Obviously, you need a high school diploma for pretty much any job. Honestly, it's easy to become a phlebotomist. At minimum, you need a high school diploma. After high school, you need to complete a short training program. Most programs offer professional certification, but you'll have to check your state requirements to find out for sure. Certification is not universally required, and there are not currently a standard for phlebotomy, but many employers will want certification from an accredited institution. Accreditation is approved by the National Phlebotomy Association, or NPA. Besides, certification makes you more competitive in the job market and demonstrates your skill level meets professional standards. Certification also shows potential employers that you're committed to this career path. Phlebotomy can be a great career choice with great hours and a fast way to get into the healthcare field. If you aren't sick at the sight of blood, you can learn how to deal with fearful patients and how to be skilled at drawing blood. Who can guess what is the starting salary for a phlebotomist?
60.
Not quite. So basically you can be a phlebotomist, so you can graduate from high school, go through just a small little program, not even college.
Wait, actually, since you can get it with a high school diploma, I would say like 40.
You could be a phlebotomist at the age of like 19. Yep.
I would say 40.
So because you, kind of, almost, because, usually the more education that's required, the higher the salary for any given job. But starting salary is $25,000 with no experience or anything. And then after a few years, and in certain cities, it gets higher, but it's up to like 43,000. So that's decent. The thing about making money, I don't know like if kids are skewed these days, but do you guys know, okay, so you've heard that different states are more expensive to live in. So if someone makes $25,000 and they live in Florida, where the rent is higher, the food is higher, the gas costs more, all of that, $25,000 isn't a lot to live on. But like I'm from South Dakota, so in the Midwest, $25,000, I mean, you can rent an apartment for $300. Food is always cheaper. Every time I go home, I'm like, oh my gosh, is everything on sale? They're like, no, it's just what it costs. I mean, everything's cheaper. So $25,000 goes a lot farther. So that's why you can't always just look at how much they make, but you need to look at where you're gonna live. So don't rule anything out because you think you would make enough money, because that's not entirely true.
Can you be a phlebotomist while you're in like college or you
Yeah. Yeah.
What about if you like want to go to med school? Would you not have time?
I mean, if you're in med school, you really can't have much of a job.
Yeah.
But I think, if you were gonna apply to med school and you that's something you wanna do, I mean, if I'm gonna look at your application to med school, and I'm looking at all these applications, and you have experience in a hospital as a nursing assistant or a phlebotomist or anything, that looks a lot better than somebody who has never had a job or like they had a paper route, you know, because I think that shows that you're really serious. Plus, you get to see things firsthand, even if you don't want to be a phlebotomist forever, but if you're considering a career in medicine, to be a doctor, a nurse, or anything, you kind of get a firsthand look at what they do, and you can see for yourself, like, yeah, it's really what I want to do, or, man, there's some things I didn't know. So, I think anybody working in any job in a hospital or a medical setting can set you up for what you might want to do. All right. Yes, thank you. Although I'm done with that lecture, so it would have been way too late if I hadn't. That's okay. All right, so we're gonna go through the next one and then we'll do a worksheet. Oh, and by the way, I think y'all know this, but the worksheets are graded. I look at your answers in the computer program. So I know it can be a drag sometimes doing them, but a worksheet as opposed to like a test, a worksheet's probably preferable, right? So I wanna make it really easy for you guys to do well in this class, and you know, it shouldn't really be like chemistry or something really, really hard. But I just want you to know, even though they're kind of a drag, they're important and it's a big part of your grade. So it's an easy way for y'all to do well in here. Does that make sense? All right. Just gonna whiz through here. Seriously, what is that? Ooh, what does this look like, huh?
Oh, like heart monitor.
Ah, electrocardiogram technician. In this lesson, we'll discover what an electrocardiogram technician does and where they do their work. Identify the physical requirements of the job and determine specific education requirements for the role. Here's Ella. Ella has been an electrocardiogram technician for 5 years, and she's going to tell you a little bit about the job. Looks like everybody has been something for 5 years. Hi, I'm Ella, and I am an electrocardiogram technician. I'm often called an EKG or ECG tech. First, let's talk about what an electrocardiogram is. Does anybody know?
Is it what we saw on the other?
Yeah,
page?
like tests like your heart rate.
How fast
and-
you want.
Yeah, all the things a heart does, how fast it goes, how hard it pumps, all that. An ECG machine monitors a patient's heart by recording the electrical impulses that cause the heart to beat. It measures how much electrical activity is produced by the heart and how long it takes for the impulses to spread through the heart. ECGs can be part of a physical exam done for routine checkups or as part of preparation for surgery. They can help the physician diagnose cardiovascular problems. As an ECG tech, my job is to prepare the patient for the test. I do this by making sure the machine is in working order, explaining the procedure to the patient, prepping the patient's skin, attaching electrodes to the patient, and operating the machine to obtain a reading. I then print the results and mount them in the patient's chart for the physician to review and interpret. I'm also able to perform Holter monitor and stress testing. Holter monitoring allows patients to be monitored at home for 24 to 48 hours. Stress testing allows patients to be monitored during physical activity. Stress tests may be either an exercise stress test, or a nuclear stress test. Exercise stress tests require a patient to walk on a treadmill while electrodes are attached to his body. A nuclear stress test is used when physical activity is not safe for the client. In this instance, the patient will receive a drug through an IV that mimics exercise by increasing blood flow to the heart. An ECG tech assists the physician during stress testing. To be able to perform these tests requires additional training. Has anyone ever had an ECG test?
Wait, ECG? What's it?
So like when they put the monitors on you, if you've ever been admitted to the hospital, if you've ever had surgery, they use that to monitor your heart. They're little like sticky.
Oh yeah, I've had the
Electrodes.
sticky notes. I've had an EKG also.
Yeah, okay.
I thought it was called EKG.
Yeah, it is, but it's EKG or ECG. It depends on what. It's the same.
Uh,
The whole history in that. Work environment. As an ECG tech, I work in a hospital. However, many ECG techs work in doctor's offices or diagnostic centers. ECG techs need to have good communication skills, customer service skills, and attention to detail. We also need to have compassionate attitudes. Patients may be afraid or in pain, so we must maintain a professional but caring attitude while helping them. Physical requirements, lots of time on your feet. One of the factors of my job that I underestimated was the amount of time I would spend on my feet. Long hours on your feet means you must invest in the right shoes with the proper support. That's important because I can sometimes work 12-hour shifts at the hospital. Also, I occasionally must lift or transport patients or move heavy equipment. In order to make sure I don't hurt myself, I use proper lifting techniques. I stretch and exercise whenever I can to make sure my body stays healthy. Educational requirements. It doesn't take long to become an ECG tech. You may accomplish the goal within a year of high school. Here are some things you can do in preparation for this career. Take classes in math, science, and computers and typing. Complete an approved program or 6 months of work experience. Get certified as an ECG tech through the American Society of Phlebotomy Technicians. You can also get certified as a certified cardiographic technician through Cardiovascular Credentialing International. Seeking additional certifications like CPR and CRAT will help you make you more attractive to employers as you grow your career. My job as an ECG tech is really important in helping doctors determine whether a patient has a healthy heart. Knowing that something I record on an ECG can save someone's life makes me feel great about the job I do. Because of that, I work really hard to make sure patients feel supported and cared for, and I make sure doctors get the information they need. Thanks for learning about what I do. I hope this gave you an idea of whether this would be a good career for you. Is anybody in here has anybody taken a CPR class before? Or CPR certified? Yeah?
What?
CPR certification? Anybody can do it. I don't even think there's a minimum age. But y'all have seen CPR like in movies or
Where would you even do that?
through the Red Cross or there's other, where did you take yours?
I did not at home, or it was like at the hospital.
Through what program or why did you do it?
I think it was a safe sitter course.
Oh yeah, that's common. Yeah, some fire stations teach it. It's just a good thing.
I thought we would do stuff like that. Will we be able to do stuff like that?
Yeah, I wanna get some, I mean, you wouldn't be like certified because I'm not a certified instructor, but, you know, if someone has a hard time in front of you, doing something is better than doing nothing, really. So, even having basic knowledge is gonna help someone more than just standing there, you know? So, yeah. I mean, I've never done CPR on an adult, I've only done CPR on a baby, which is kind of,
You have to do it
Well,
like
like
you have
one
to like
finger?
hit their back.
that's if they're choking, but for
Okay,
like,
right.
it's really like with your thumbs, whereas with an adult, you'd be using your whole body, but for a baby, it's just your thumbs, so it's kind of easier. Also scarier.
I feel like that couldn't be like a, especially to do with kids. I feel like if I do with kids, it's a lot harder than